Hi everybody, this is the third part of the presentation Extraocular Muscles Anatomy, and here we're going to talk about blood supply of extraocular muscles, innervation and vortex veins. In general, anterior segment blood supply is being provided from anterior ciliary arteries, long posterior ciliary arteries, which are also creating an intermuscular circle. And of course, in the intramuscular circle, as you can see on this schematic picture, is also taking participation in a recurrent choroidal artery. This is a schematic of the blood supply of the anterior segment from Sanders and his colleagues. Of course, I modified a bit with some additional pictures to make it even more clear to imagine. In general, additionally, the anterior ciliary arteries are dissected from the superficial capsular muscle tissue, allowing repositioning of the muscle while leaving blood flow undisturbed. Vortex veins. It's very important to know the topographical location of vortex veins. There are 4 vortex veins: medial, lateral, superior vortex veins and inferior vortex veins. As you can see here on the photo, those blue circles which shows their location of those vortex veins. And additionally, we can see here on the posterior aspect of the globe, the long posterior ciliary arteries and short posterior arteries and veins. The superior temporal vortex vein is seen at the posterior insertion of the superior oblique, as you can see on this photo. And vortex veins are not seen routinely during surgery on the superior rectus. Here, a vortex vein may be seen, but rarely at either borders of the medial rectus as well. Vortex veins are seen at one or both borders of the inferior rectus on this photo. And the vortex vein is seen routinely under the mid-belly of the distal inferior oblique. And that's why you have to be very attentive when you do a surgery on the inferior oblique muscle. You have to think about vortex vein, especially when you hook the muscle or make resection or recession, or in general cut the muscle. Sclera. It's very crucial also to know the thickness of the sclera or different parts of the eye globe. At the limbus, the sclera is 0.8 millimeter thick. Anterior to the rectus muscle insertion, it's 0.6 millimeter thick. Posterior to the rectus muscle insertion, it's 0.3 millimeter thick. That's why when you do resection of the muscle, it's very important to be careful. I still remember when I was doing my first resection of the muscle during my fellowship course, I remember the voice of my supervisor who was telling me, be careful, it's a resection. Be careful, it's a thinnest part of the sclera. At the equator, it's between 0.5 to 0.8 millimeter thick, and the thickest part of the sclera is at the posterior pole when it can be 1 millimeter thick or even greater. And again, the sclera is thinnest 0.3 millimeter posterior to the rectus muscle insertion. Here you can see on the photo those thin area of the muscle where they're behind the muscle, thinnest area of the sclera behind the muscle, which you have to be aware. So here you can see a different kind of spatulas when you put the suture on the sclera during the extraocular muscle surgery. So there are different types of spatulas: a keystone spatula cutting tip down, keystone spatula cutting tip up, then neutral cutting tip. I prefer to have with hexagonal spatula. I usually work on this kind of spatula. With this kind of spatula, it's more convenient for me personally. Then reverse cutting tends to cut in and can be placed sideways. And on the E photo, you can see a curved cutting tends to be cut out. And this is a blood supply of the extraocular muscles, and you can see that the main artery is ophthalmic artery with its three branches: infraorbital artery, lacrimal artery, and muscular artery. Of course, the main blood supply of extraocular muscles comes from muscular artery with lateral, medial, and superior branches, and of course, partially in blood supply of extraocular muscles, taking participation also infraorbital artery and lacrimal artery. Here on the scheme, you can see the definite supplies of each muscle. And the blood supply to the orbital layer is much more extensive than that of the global layer of the muscles. Ocular muscle innervation. So here on this slide you can see innervation of the left eye and innervation of the right eye, but in general there are just three types of nerves, with cranial nerve 3, oculomotorious nerve, cranial nerve 4, trochlearis nerve, and cranial nerve 6, nervus abducens. So it's for lateral rectus. Cranial nerve 3 is for inferior oblique, superior rectus, and medial rectus and inferior rectus, and trochlear nerve is for superior oblique. This was all the topic and the last part of the extraocular muscle anatomy presentation. It was much shorter than previous parts. I hope you find it informative and interesting for you. Please subscribe to my channel and stay updated for the next videos. Thank you for watching. Bye.